We're about to introduce you to a man named Walter Schroeder. Business has been good for Walter. He made a lot of money. Now he wants to use those resources to build a new healthcare clinic just north of Toronto. And strangely enough, he doesn't want to make any money off it. The only problem, this might not quite be kosher. Let's figure out what's going on here. Joining us now from Marco Island, Florida, there's Walter Schroeder. It's good to see you again, Walter. How are you?
Very well, thank you. Very well.
Excellent. Let's start from the beginning here. What kind of healthcare facility do you want to build?
I want to build what's called an ambulatory surgical center, which is a fancy name for same-day surgery. You do surgery, wait about 4 hours, you release the people. So you can do with that volume equal to probably about triple what a typical hospital can do, which is what our aim is to improve the efficiency of health and to help a lot of people get surgery that otherwise they wouldn't get.
What kind of surgical procedures are we talking about here?
We're talking probably a couple of types. It's got to be related somehow to pain. I'd like to alleviate pain with people, physical pain, and overcome the pain. So it's basically orthopedics, a lot of joints, knees, hips, shoulders, elbows, and done in a very, very high volume fashion, the same day release of the people. We can only hold the people 23 hours and 59 minutes, and they got to go. That's it.
Gotcha.
So it's going to be high volume.
Where do you want to build this clinic?
The building is 90% done. It's 15 miles from the Lake Ontario down Leslie Street. So Leslie plus 15 miles. It's 125,000 square feet, and it's virtually 90% done.
And what municipality is that in?
Richmond.
Richmond Hill. Okay.
Yep.
How much have you spent to build the place?
Well, it's going to cost us, put it this way, it went into bankruptcy. They put 95 million in. We found an opportunity to buy it for half that price. So we're putting half the money in to secure it. It's going to probably cost another close to 40 million to finish it. And then what we want to do is give it state-of-the-art equipment in orthopedics, and our second big venture is going to be imaging. So total cost over 100 million.
$100 million. And where is all that money going to come from?
Well, it's coming from our foundation. It's just coming basically from us personally. We've already committed over 80 million to Ontario Health. So this will be in addition to that, and will be designed to help people overcome pain and reduce the elective surgery list, which is skyrocketing in orthopedics.
So no money out of the public treasury for this? Not
We're
for the
looking
building
at
of the
doing,
place?
Well, the total thing is going to come to over 200 million. So we're asking we're employing 2 public hospitals. What the public hospitals will do, we'll be getting a loan probably somewhere in the 50 to 60 million range to help equip part of it, because the total bill will easily come to over 200 million. And we're maxing out at 150. So whatever the difference is, will have to come from public funds. But it's going to be triple us, and likely no more than 50 to 58 million from the public purse. That's it.
Okay, and do I have this right? You want to run this as a not-for-profit? You don't want to make any money off this?
We're not making any money off it. It's 100% charity. What we're trying to do is roughly about 40% St. Mike's Hospital is involved. Then another 35 to 40% of the square footage is going to go to another hospital. And we'll be in there with the clinic, but it's going to be 100% nonprofit. So this is not for profit, not 1 cent. We're not going to see 1 cent back from it. But we're going to help in the coordination between hospitals. Right now, Toronto hospitals really compete with each other. And we think we can partly change that by bringing a bunch of hospitals together to help with the surgery. And the surgery is going to be 100% of St. Mike's or this other hospital we're looking at. So we're not going to be doing that. But we're going to be providing the funding. We're going to bring the hospitals together, and we're going to coordinate a clinic with surgery, with an attempt to reduce pain and reduce this terrific elective surgery backlog they have in Ontario right now today.
Oh, I know. The Financial Accountability Officer came out several months ago and said it's getting up there close to 500,000 procedures that are in the backlog right now. But again, I just want to hammer this home. The idea, if and when this is up and rolling, is that people would walk in, they'd put their OHIP card down, and all the services in there would be covered by the provincial health insurance plan. Yes?
It's going to be major of that. It's going to be mainly OHIP. We're going to have a clinic that's going to be doing things that are permitted right now. So the clinic part of it that we're going to be operating will be probably partially out of OHIP, if it is out of OHIP right now. But all that money is going to stay in the hospital, and it's going to be used either for equipment, or what our dream would be to subsidize free operations for people without OHIP at all. So the excess cash that we generate will either be used to subsidize free operations for people entirely, or will be used to buy modern equipment for the clinic, but nothing back to us, zero back to us.
Okay, I have an obvious question then, Walter. Why do you want to do this?
Well, I had a very successful life. Everything seemed to work out well for us in life, from university, from living in what today is the second and third poorest postal code in Canada. I grew up in the R3A, R3B postal code.
What city is
the
that?
Inner city, Winnipeg.
Winnipeg. And how did you make your money?
Made my money by taking a lot of chances and a lot of risk, creating a debt rating agency on the way to Montreal in the red Volkswagen with my wife taking notes and us getting there in 1975. And then a lot of hard work over the next 40 years. And we became number 4 in the world, made a lot of money, sold it in 2015. And then I resolved to help people and help society with a good part of the money.
I think people have probably heard of it. Dominion Bond Rating Service was you, right? DBRS?
That's right. It's still number 4 in the world. And no longer, I don't have anything to do with it at all. We sold it 100%.
Okay, let me ask you a bit of an unusual question here, and that is what you're trying to do legal?
It is, because we're not doing anything outside of OHIP. Anything that's going to be done is going to be done by 2 hospitals. They're going to do the operations, and we're just going to provide really a couple of things. We're providing the real estate, which will go free to them. And secondly, we're providing much of the modern equipment, because donors today provide equipment for hospitals, basically. It doesn't come from the hospital, it comes from donors, and that's what we're doing. We're providing free real estate and free equipment, and the rest is up to OHIP, and it's going to totally stay within the hospital area. So,
all right, are all the I's dotted and are all the T's crossed, and is this a done deal?
It is from our part. We're going ahead with it. So let them close us down if they don't want to cooperate. But
well, what does the Ministry of Health have to say about it?
They're cooperating right now. They're looking at finalizing the funding.
Let me ask you this. You know there are people who are watching this right now who believe that it is inconsistent with Medicare to have anything privately owned, the likes of which you are doing, even if you want to run it as a not-for-profit. Could you speak to that concern of theirs, please?
Well, I think it's nonsense. I think right now, my expertise was credit ratings international. That was international countries. It was Canada. It was the provinces. It took Canada. It took the federal government 154 years to accumulate $800 billion in debt. Now, in 1 year, they're accumulating possibly $350 billion, and they're going to keep going at $100 billion a year. They haven't got enough money right now to keep doing the health system the way it is privately. You can see how it's collapsing. What we're doing is nothing for us, 100% for the people, and we're not asking for outside money outside of. St. Mike's is going to get some money to finish the operating rooms, and then what we're going to do is we're going to have 8 operating rooms that we're going to equip with 4 people you need for orthopedic surgery for an operating room. We'll equip them with that, and then allow qualified surgeons from all over Ontario to bring, say, 4 or 5 patients, which they can do in one operating session day. They can bring 5 patients down, do 4 or 5 hips, and the hospital is going to equip, at the hospital's cost, it's going to equip the operating rooms with the 4 people needed for surgery. The lead surgeon is going to bring his people with him that need orthopedic surgery, and they'll get it done in one day.
I'm
Go
sure.
home the same day.
I'm sure our viewers are going to want to track your progress. What's this thing going to be called once it's up and going?
Well, we're calling it right now. We're going to call it right now the Richmond Hill Center. I'm not sure if I want to name it. We haven't decided that yet. We hope to have that thing done in 18 months is our aim.
Well,
But they tell me, the architects, it would take 70 years to do this from scratch. We're going to do it in hopefully 18 months. And our aim is to do 8,000 surgeries a year, which is equal to most of the Toronto hospitals in orthopedics. And we're also looking at a cancer unit. And then we're looking at the clinic that's going to look and give people health assessments looking forward. So looking at blood tests to tell if you've got cancer. They can identify 50 cancers with a blood test. If we can streamline through from the blood test through to treatment and find cancer before it really gets going, then that's one of my objectives. And again, we're not making any money at it. It's not private health at all. St. Mike's and this other hospital are going to be running all the show with anything to do with surgery. We're providing free real estate. We're providing brand new equipment, and we're providing coordination between hospitals to make sure the hospitals work together. So,
well, Walter Schroeder, we are grateful for your time tonight. Thanks for telling us how this is all going to work, and we'll continue to track your progress and maybe talk again down the road.
Thank you. We're going to get going on this too. We want this to happen.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.